I'm Karen Strange. This is an introduction to the NRP 8th edition. So, what's new? Well, there's a new book, there are some practice changes, there's a new NRP learning platform, there's no eSIM, and you have to choose between Essentials or Advanced. So what does all that mean? Well, it means there's no more HealthStream. It's now called the NRP Learning Platform. There's a video on the NRP site that walks you through registering and getting your new global ID. You do have to choose between Essential or Advanced course, and I'm going to go over that now. So, Essentials. Essentials includes Foundations of Neonatal Resuscitation, Anticipating and Preparing for Resuscitation, Initial Steps of Newborn Care, Positive Pressure Ventilation, which includes the LMA. Now, Essentials is for anyone involved in the care of a newborn. The NRP Essentials participant will be responsible for learning the material in lessons 1 through 4 only. NRP states that Essentials is most appropriate for those assigned responsibility for the newborn at birth when there are no apparent perinatal neonatal risk factors, and for those who care for healthy newborns after birth. Now, NRP Essentials may not be appropriate for healthcare professionals who will participate in resuscitation beyond positive pressure ventilation. So what's missing from Essentials? Well, as you can tell, Essentials lacks chest compressions. Essentials includes all the initial stops before chest compressions. This is because NRP is written for the hospital setting. If you're resuscitating in a hospital, there most likely is going to be a team to take over and perform chest compressions if necessary. Now, in the out-of-hospital setting, you might be alone or with a partner, but you won't have access to a resuscitation team. So your actions are going to be different. In the out-of-hospital setting, your main job is to stabilize and prepare for transport, which means doing the initial steps, delivering positive pressure ventilation, preventing heat loss, possibly giving chest compression, preparing for transport, and transferring to a hospital. Now, this is confusing for the out-of-hospital setting because it is important to understand and be able to perform chest compressions in the out-of-hospital setting. If given, you have already aerated the lungs, meaning cleared the fluid in the lungs. Now, the American Heart Association, the American Red Cross, and Basic Life Support, adult, child, and infant CPR chest compressions are not the same as the American Academy of Pediatrics Neonatal Resuscitation Program chest compression recommendation for newborns. Now, neonatal animal studies have actually shown that a 3-to-1 ratio shortens the time to the return of spontaneous circulation. Now, NRP recommends a 3-to-1 ratio and not a 15-to-2 ratio. So, using CPR recommendations for newborns is not following NRP guidelines and is not recommended for newborns. So what is in Advanced? Advanced includes, again, the Foundations of Neonatal Resuscitation, Anticipating and Preparing for Resuscitation, the Initial Steps of Newborn Care, and Positive Pressure, including the LMA, which is everything that was in Essentials. Plus, you're going to need to know endotracheal intubation, chest compression, medications, resuscitation and stabilization of babies born preterm, post-resuscitation care, special considerations, and then ethics and care at the end of life. Now, Advanced is for anyone expected to participate in resuscitation beyond positive pressure ventilation. Now, the NRP Advanced learner will be responsible for all the material in lessons 1 through 11. Either learner, Essential or Advanced, may study the last 3 supplemental lessons, but they will not be tested on those lessons. NRP Advanced is suited for healthcare professionals who serve as members of a resuscitation team in the delivery room or in other settings where complex neonatal resuscitation is required. Now, NRP Advanced may also be appropriate for healthcare professionals in smaller hospital facilities with fewer personnel, where most healthcare professionals who attend births or care for newborns are expected to participate in neonatal resuscitation. Now, there are 3 supplemental lessons, which I think I just mentioned to you. Chapters 12 through 14. This is for enhanced learning. You're not going to be tested on those 3 chapters. I recommend you read them. So you may be wondering, how do I choose? So first, do you work in a hospital or in the out-of-hospital setting? Next, consider your state or locale, your scope of practice, and your facility requirements. For hospital-based providers, each facility determines its own policy for who should attain NRP Essentials or Advanced Provider status. If most staff participate in births with risk factors and are called to assist with complex resuscitation, then only a small number of select staff with limited responsibilities may be suited to NRP Essentials. You should contact your facility with questions about which one you should take. Now, for the out-of-hospital-based providers, keep in mind NRP is a hospital-based course. It always has been. It is written for hospital setting. There's no specific recommendation for planned out-of-hospital birth. Those of you under NARM know that NARM is leaving it up to you, the provider, to decide which route to take. So be sure to read NARM's statement on their website. It seems like all organizations in the out-of-hospital setting are not sure how to direct everyone, so you have to get a little educated to make your decision. This is how I look at it from the midwifery perspective. You need to consider your state of licensure and practice, your scope of practice and facility requirements. Then, since there's nothing clearly stating how an out-of-hospital practitioner should clearly preside, be aware of several things. Many people say the advanced skills are cool. What's the problem? So let's talk about the skills covered in advance. These skills, they are cool to learn in class. But learning about a skill is very different than being proficient and accomplished, experienced and up to date. I often hear how cool it is to take the training and learn all those cool advanced skills, and how neat the simulation is with the chicken bone and the drill. And I totally agree, it's cool to learn. Learning new information and knowledge is intellectually stimulating and interesting. However, jumping from right from the beginning of the NRP book, where it states that the NRP is an educational program that introduces the concept and basic skills of neonatal resuscitation into actually thinking these are skills that you should be doing in the out-of-hospital setting, where you practice one day on dolls, is where the problem lies. So, a couple of things I want to get into. Let's talk about competency, the ability to do something successfully or efficiently. Training, learning and practicing under adequate supervision over time. And proficiency, that's a high degree of competence or skill, expertise. It actually takes training and supervision to gain competency and proficiency, where you can use these skills with confidence in the appropriate situations and settings. Training takes learning on a model, then practicing on real live subjects with a supervisor and doing ongoing supervision, then accruing experience over time. The bottom line is you can't get to a level of proficiency as a midwife. I say there are pretty much no midwives that work in the out-of-hospital setting that have the opportunity to be trained and practice on live subjects under supervision to adequately perform these skills. I would even say most nurses and delivery room support do not either. It is the resuscitation team, the NICU team, the neonatal nurse practitioner, the respiratory team that have the training, the supervision, and the practice to be proficient to know when to add more technology. We sometimes hear the argument that you want them to practice these skills and learn about the skills in NRP so they can be a better assistant. But think about that. Even in the hospital, you're not going to be assisting at this skill, pulling out the right intraosseous needle or loading epinephrine syringes. I promise you, the resuscitation team won't let you near their resuscitation equipment. The team will be handling it all once they are there. And anything you start, they're not going to be happy with. It's not your role. And in the out-of-hospital setting, you have other tasks at hand. In the out-of-hospital setting, your job is simplified. Well, sort of. You're going to be doing the initial steps. You're going to be doing thermal management. You're going to be clearing the fluid in the lungs with those first 15 seconds of positive pressure. If they're not going in, then your job is to do the corrective steps, or Mr. SOPA, mainly airway and seal. Adequately ventilating the lungs until the baby breathes on their own or until help arrives. Now, appropriate newborn chest compressions you would do if the heart rate was below 60 after 30 seconds of effective lung inflation and preparing for transport. Now, in the out-of-hospital setting, if a baby isn't breathing or breathing well, it's your job to respond appropriately. That means doing what the baby needs. In the out-of-hospital setting, we're used to seeing normal. So when a baby comes out that does need your help, sometimes it kind of catches us off guard. Seeing a compromised newborn, well, there's a lot to manage, a lot to do, not the least of which is what's going on inside you. Whether you're alone or with a partner or an assistant, you have to get the position of the baby correct, good, so that the air can go in. You have to get a good seal, making sure the air is going in, doing all the corrective steps if what you're doing is not working, and ventilating, keeping in mind those first few breaths that go in are about clearing fetal lung fluid. Depending on the baby, it may be difficult to do these seemingly simple steps. Getting a good open airway sometimes is challenging on a very compromised newborn. Getting an adequate seal sometimes takes practice and work. Then if your baby has a heart rate of less than 60 beats per minute and you've done those 30 seconds of positive pressure where the air is going in, then you will need to perform chest compressions. This can also be difficult because when faced with a non-breathing baby, a very compromised baby, fear and panic can take a tight hold and hijack your mind, making it difficult to effectively perform skills. It just seems so simple. So why not do advanced skills? This should help, right? Wrong. Even very experienced midwives often have difficulty with doing those basic steps, but on a very compromised baby, it changes. It comes back to midwives seeing normal. Birth is set up to work, so most of the time you don't need to do anything. But when faced with a compromised baby, it sends our bodies into panic and fear. It's a normal physiological response, but it does impact our ability to perform skills and think clearly. It's not about being able to understand the information or being able to do it during a controlled assessment like skill testing. It's about being able to do the most appropriate action considering your setting, your staff, and your scope of practice. I've noticed that when I teach my in-person skill testing, and I have everybody get comfortable with their equipment, they pull out their oxygen tubing, their oxygen reservoir. We're talking about compressions. We're talking about the use of 100% oxygen when you do chest compressions. And I have them practice attaching the tubing onto the bag, the reservoir onto the bag. And I have noticed that at least a third of the midwives are unable or having difficulty figuring out where the tubing goes, which end of the tubing goes on the bag, where the reservoir goes. They're looking at the oxygen reservoir, not sure where that goes. That's a third of the class, and everyone is supposed to have just read the book. It's not that they aren't intelligent or not good at their skills. It's that these skills aren't used or practiced with enough regularity to gain proficiency. But that's why we practice the skills that are necessary for our setting and our client and the clientele that we're serving. Adding additional skills, which may be inappropriate for the out-of-hospital setting, only adds to the confusion. If you skip any steps or perform a skill you don't know how to do, it can mean the difference between life and death, which can also mean the end of your practice. It's important to get really, really good at doing the simple steps because that's what brings babies around. Clearing the fluid in the lungs, oxygenating the heart muscle is the most likely problem, which means ensuring you have those effective ventilation, right? Airway and seal. I know that I repeat myself a lot, but these are imperative to delivering appropriate skills of positive pressure ventilation. Now, when you start considering advanced skills, it takes you away from what you should be focusing on, waste valuable time. NRP is a basic entry-level course. The NRP is an educational program that introduces the concepts and basic skills of neonatal resuscitation, and completion of which does not imply competency. So when NRP puts advanced on your card, it doesn't mean that you're automatically allowed and entitled to perform those skills. It may even go beyond that, where you may actually be liable for performing these skills that you're not proficient in, even though it's on your card. Keep in mind, the NRP card is a course of completion and not a certification. Now, on the other hand, you also may be potentially liable for not performing skills in certain situations. It's important to remember that NRP is written for the hospital setting and they have no recommendations for planned home births. This can put you in a sticky situation. So let's talk a moment about liability and malpractice. It's nearly impossible for most NRP providers to have adequate training and experience in advanced skills. Does this expose those providers to additional liability if their performance of those skills is not adequate when needed? If an NRP provider is performing skills outside the scope of practice, will malpractice insurance cover lawsuits requiring you to use those skills? If your malpractice carrier will not cover you, will you then be personally liable? If you choose not to perform advanced skills yet have completed the advanced skills in NRP, will you be liable due to your decision not to use those skills during resuscitation? These are some questions that I'm just putting out there. They come from an archived NRP instructor update. If you have a bad outcome and you use an NRP skill, which you have not had extensive training nor supervision on, you probably are going to be liable. Will NRP, will NARM, will MANA, will ACM, will CABC vouch for you if your case goes to court? Odds are low. Or think of it this way. Will the neonatologist from the respiratory team that receives you back you up if you brought in a dead baby that you had intubated and put in a UVC line incorrectly while not ventilating? Probably not. Your job is to do the steps of newborn resuscitation really, really, really well. If you can get good at those steps, then you'll be setting yourself, the baby, and the family up for success. Otherwise, you could intentionally cause more harm than help. So, story time. I want you to consider this scenario. So you have a baby that is born severely compromised. You've never seen a baby this color of gray or this flaccid. You're shocked to see a baby this depressed, this bad off. You never imagined this was possible in a home birth. You start rubbing vigorously, yet the baby's not coming around. You finally grab your bag or you do mouth-to-mouth and you start positive pressure ventilation. The ventilating is not working. It's difficult to keep the airway open and get a good seal because the baby is so flaccid and limp. You attempt to do the ventilatory corrective steps, though inside yourself you're driven to just squeeze the bag harder and push harder on the face, trying to get the air to go in. You think, let's insert an LMA, right? You start grabbing at the LMA, but you are missing that the LMA is meant to be used after you have done all the steps of Mr. SOPA and not before. You stop ventilating to insert the LMA. The heart rate goes down. But because you're so panicked, you keep trying to get the LMA in. You do several attempts to insert it. The heart rate is still going down. You're still struggling, and the baby is not being ventilated. The situation is actually more common than you'd believe. When we see something we've never seen before, like a severely compromised baby, our bodies have a physiological response. We get flooded with adrenaline, which is a good thing, and you get tunnel vision, which can be a good thing. Some providers become hyper-focused and move to the most appropriate action, while many providers experience panic. For some, it takes some time to reorient in order to respond appropriately. For some, there's a lot of grabbing at anything nearby, skipping steps and taking inappropriate actions. The response to seeing a severely compromised baby is really rarely talked about, what you feel and how you respond. And it has a direct impact on what we do and how we do our skills. Now, you start adding in the advanced skills, which you have no experience on, that wastes valuable time. So just think about this. If it was your baby, would you want a provider that had taken an afternoon course and practiced on a doll for an hour? Or would you prefer a provider that knows how to do it and has done it many, many, many times before? I mean, the bottom line is that NRP is a hospital-based program. It's not written for the out-of-hospital setting. So neither route, essential or advanced, is the perfect option. For most midwives, the material taught in essentials will fit the majority of their needs. However, it does lack chest compressions. The material taught in advanced is inappropriate for the out-of-hospital setting. The most important aspects of newborn resuscitation are thermal management, effective ventilation, and preparing for transfer. My integrated resuscitation and newborn course on Teachable, which is required before attending my live skill testing, does include all aspects of newborn resuscitation, including chest compressions, regardless of where the birth occurs.